Hello, everyone. Welcome to today's third National Nursing Research webinar. My name is Dr. Minya del E. Morales. I'll be your host and moderator of the day. I'm affiliated in Asian Hospital and Medical Center as the Patient Safety Officer and also an adjunct professor of Lyceum of the Philippines University, Batangas. Glad to be your host and moderator of the day. Before we start, let us put ourselves in the mighty presence of God.
Lord, as we plan and share together now, may we guide us with your Holy Spirit, lead us into all truth. Lord, as we go into this third National Nursing Research webinar, we place ourselves before you, for you are filled with the beauty and light and care deeply about us. May your Spirit guide us. May your grace abound in us. Okay. So before we proceed, I'd like to have some housekeeping announcement. The recordings of this webinar will be shortly available at the Beta Nu Delta Nursing Society YouTube channel. Okay, so this event, as previously mentioned, was or is organized with the Beta Nu Delta Nursing Society in collaboration with the Visayas State University, the Journal of Health and Caring Sciences of the San Beda University. We have some well-wishers messages from our VIPs. To start with, let's hear a message from Senator of the Republic of the Philippines, Honorable Ronald De La Rosa.
The attendees of the third National Nursing Research Webinar. Kumusta po kayo? This is Senator Bato De La Rosa. I would like to personally thank you for your invaluable service to our countrymen. Both the attendees of the third National Nursing Research Webinar. Kumusta po kayo? This is Senator Bato De La Rosa. I would like to personally thank you for your invaluable service to our countrymen, both here and abroad. Talagang napaka-importante po ang inyong profesyon, ang nangangalaga sa kalusugan ng bawat Pilipino. Lalong-lalo na sa panahon ng COVID-19. Sana po lagi kayong safe and healthy. Ingat po kayong lahat. And again, salamat sa sakripisyo. Tunay po kayong mga makabagong bayani. Mabuhay po ang Filipino nurses. God bless.
Another message from Professor Karisma Otutal, President of Sulu State College.
Hello, Assalamualaikum warahmatullahi ta'ala wal barakatuh. Good day, everyone. Research is the hallmark of a professional. No profession can have its strong footing without having its practice derived out of rigorous research endeavors. As a nurse by profession, I am very happy to share my thoughts on this aspect. Every country in a particular social milieu presents a different sets of unique problems, calling for the profession to devise ways and means to solve them in a manner which is in tune with the country. Nursing is no exemption because research is vital to improving healthcare delivery and outcomes. Nursing research has the potential to revolutionize healthcare. Nurses with research skills are equipped for evidence-based practice to ensure better standards for caregiving. It is true that nurses teach, organize community health, work in business, and of course, work in clinical setting. And research is important for all these areas. And nurses must be a part of this because it helps them advance their field, stay updated, and offer better patient care. Lastly, I always believe that research is seeing what everybody else has seen and thinking what nobody else has thought. And that is making a significant difference in the lives of many. Thank you.
I would like to hear a message from Professor Maria Carla Ochotorina, President of Western Mindanao State University.
Dr. Edna Magpantay Monroe, registered nurse and advanced practice registered nurse in the state of Hawaii, and one of the founding faculty for Chaminade University of Honolulu School of Nursing and Health Professions, Dr. Janet Ignacio, the Associate Professor and Program Director of Alice Lee Center for Nursing Studies, Yonglu Lin School of Medicine, National University of Singapore. Participants, Beta Nu Delta Nursing Society, fellow nurses, friends, buenos dias a todos. This invitation to give a commemorative message to this highly esteemed organization came as a surprise to me. However, knowing that this organization is formed by a profession closest to my heart gave me a feeling of gratefulness and pride. The nursing profession is for me the noblest profession as it demands hard work, dedication, and an extraordinary amount of compassion and selflessness. Nurses put themselves in harm's way just because they care for people. The amount of work they put in many sometimes go unnoticed, but during this time of pandemic, we have witnessed nurses continuously serving in the front line of hospitals, schools, communities, and government healthcare agencies, fighting an unforeseen enemy with so much care, compassion, grace, and strength. Such are the qualities nurses possess that are extraordinary in so many ways. The multiple roles and functions nurses play speaks of the dedication, hard work, and skills they have mastered in the years of nursing practice. Indeed, nurses have the most intimate understanding of the patient's needs, whether it's physical, emotional, or socio-economic. True enough, as Dena Will Cardillo puts it, nurses are the heart of healthcare. Gone are the days the nurses are treated like lowly handmaidens, for we now occupy an equally important role and are equally responsible for the overall care of our patients. For decades, we have shown the resiliency of the nurse's spirit as we rise above crises from the upheavals, wars, and pandemics, and nurses went above and beyond their call of duty in the discharge of their functions with so much compassion, setting aside their well-being. The ultimate challenges our nurses are facing today are brought about by the COVID-19 pandemic. These are ethical challenges, as accurately documented by Guillaume Gibrehit in the Journal of Multidisciplinary Healthcare, published in April 15, 2021. Generally described into three categories: the problems encountered by our nurses worldwide concerning the following. First, limited resources allocation. Second, nurses' safety due to compounded roles. And third, moral distress due to patient-nurse relationship. The first ethical question is raised due to the lack of protection of nurses across the health industry, basically pointing to unclear legislation over the incentives and health protection. The second is the intricate expanded roles of nurses who are exposed to more patients despite adding to their moral distress in a stressful situation. We are in an unpredictable era where everyone, especially nurses, are like soldiers who are expected to prioritize public service over personal safety. But with everyone helping one another to fight COVID, through mindful observance of the health protocols, we can rise above the present predicament. Thus, let me take this opportune time to commend the Beta Nu Delta Nursing Society, a group of dynamic nursing leaders and researchers, for this third National Nursing Research Webinar, for the opportunity given to everyone in the nursing profession and its collegiate members. As Florence Nightingale once said, let us never consider ourselves finished nurses. We must be learning all of our lives. This academic research forum is so timely. You are doing an excellent job of informing and equipping our core nurses with new updates in nursing research, presenting us with empirical data that would further advance our healthcare services as we badly need amidst the present health crisis. Once again, thank you for this opportunity. Mi saludo y amor para a todos. Miles de gracias.
Thank you very much to our well wishers. At this point, Dr. Migs Morales will be joining us again. Thank you. Dr. Migs, take it away.
Okay, so is my audio clear? No.
Yes, sir.
Okay, can you make me a host? Thank you, Doc.
Yes, Doc Migs.
Dr.
So good morning again. So for today's theme, the third National Nursing Research Webinar, the theme is Transforming Nursing Practice Through Research, sponsored by the Beta Nu Delta Nursing Society, Visayas State University, and San Beda University. So for us to start, my call on the Dean of College of Nursing of Visayas State University, Dr. Joel Ako.
Thank you, Dr. Morales. My respect to the organizers of this third National Nursing Research Webinar, the Beta Nu Delta Nursing Society, our partners and collaborators, the Visayas State University, the Journal of Caring and Health Sciences of San Beda University, our esteemed keynote speaker who will be introduced a little later, our nursing PhD presenters across the country. Ladies and gentlemen, I bring greetings of safety and health amidst these trying times. Years back, the international community recognized the role of nurses nursing the world. It was also on that same year wherein humanity was tested on its worth as the health crises were felt. The pandemic highlighted the crucial character of human nurses in its battle towards unending human care, not only in the academe, where educators are taught to migrate to online learning, more so with our nursing practitioners and administrators are also called to reframe the art of caring while sustaining science of doing care. All these encumbrances imparted degrees of innovations and changes, exhausting available resources, stretching strength, and best practices sprouted, leading to a transformed nursing practice. While these changes are observed creating healthcare system exceptional, the premise of doing holistic human nursing is left unchanged. Revolutionizing nursing practice may happen through the demands of times, but the essence of recognizing personhood, living, growing in a caring environment through nurturing relationships should always surface as expressions of unending care. This year's reflection is anchored and inspired on the individual experiences of our colleagues as they were involved in various makeovers. Their familiarities and understanding will now become our synchronous breathing towards transformative nurturance of human becoming. The higher education institutions on one end is commissioned to deliver research as one of our fourfold functions. Similarly, our profession's future and asset is obtained through uninterrupted commitment of lifelong learning activities, continuing professional education, doctoral studies, or even our postdoctoral research rendezvous with the hope of keeping quality of life and or improvement thereof. Research is considered to be our backbone of introducing breakthroughs in healthcare while embracing the evidence-based practices. In general, I commend the men and women behind this year's national gathering, wherever you may be at the moment, maybe in the Philippines or in oceans apart. Welcome and good day.
Okay, thank you very much for that warm, heartwarming opening remarks. For us to welcome the participants across the globe, may I call on Dr. Rudolph Seymour Martinez, the Editor-in-Chief of Journal of Caring and Health Sciences.
Good morning, everyone. Nursing, they say, is a professional discipline. Its unique body of knowledge gives a distinct perspective on human health experience that no other discipline has. Nursing's ability to express this nursing knowledge geared toward the betterment of human life is the essence of its sacred societal contract. With this, the continued development of nursing knowledge and its expression in practice is imperative for nursing to answer the societal call that has created it as a profession. Central to this development is research. May it be disciplinary or professional nursing research, the goal of improving the human health condition is nursing's reason for being. This third National Nursing Research Workshop is one of the various ways by which we, as a collegial body, realize our social responsibility of improving our practice expression through research sharing and dissemination. May we all learn insights within this sacred space that the third NNRW aims to produce. Thank you and happy learning.
Thank you very much, Dr. Martinez. So indeed that the nursing practice should not be stagnant and should be transformed and be adaptive in these changing times through one of the greatest tool is at hand is research. We should translate our finding to actionable and meaningful results driven approach. So to introduce the speaker, our keynote speaker for today is a graduate of Doctor of Education, University of Phoenix Educational Leadership, Master of Science in University of Maryland, Bachelor of Science in Nursing, University of Illinois. She is one of the founding faculty of Chaminade University, Honolulu School of Nursing and Health Professional. She is licensed as a registered nurse and also an advanced practice registered nurse in the state of Hawaii. She has practiced in several specialties in nursing, including intermediate care, medical and surgical, mental health, community health, home health, utilization management, case management, workers' compensation, call centers, nursing administration, and nursing education. Her research interests are emotional intelligence, mindfulness, coaching, psychiatric mental health issues. She is active in her service to the student and school and community. Some of these activities include, but not limited to, President of Sigma Theta Tau International Gamma Psi at Large Chapter, Advisor, Consultant of State of Hawaii Student Nurse Association, Co-Advisor of Chaminade, the Filipino Club, mentoring students to present their creative work at the Naliko Psi at Large Chapter, founding member of Asian American Pacific Islander Nursing Association, Hawaii Chapter. She's a Marianist Education Associate for CUH. She's married to Michael Monroe, a retired Chief Warrant Officer of the U.S. Coast Guard. They have one son, Donovan, and terrier mix named Tiana. The family loves to go out and try new restaurants and travel. Now let's hear from our excellent and credible nurse leader, innovator, and a researcher, Dr. Edna Magpantay Monroe.
Aloha, everybody. It is my pleasure to present the keynote speech for the third National Nursing Research Webinar. The title of this talk, And the theme for today's webinar is Transforming Nursing Practice Through Research. My name is Dr. Edna R. Magpantay-Monroe, and I'm Professor of Nursing and Health Professions from Chaminade University of Honolulu. Just a brief introductions. As you could see in the slides, I had mentioned my level of education, receiving my bachelor's in science at University of Illinois, Chicago, my master's of science with focus in primary care as an adult nurse practitioner at University of Maryland at Baltimore, and my doctoral degree with focus on educational leadership and doctoral in education at University of Phoenix online. I'm currently a faculty, as I said earlier, at Chaminade University, the only Catholic university in the state of Hawaii. Since this webinar is about research, I want to share with you guys that I am a qualitative researcher by heart. My interests are topics of emotional intelligence, student success, mindfulness and compassionate, military issues, and mental health issues. I also want to share with you guys that in as much as I enjoy research, I also enjoy collaboration with peers. My recent collaboration is a short story, an anthology. One of my short story has been included in this book called Pinay. There is already a second version, but unfortunately I was not able to make the second edition, hopefully the third. And then also recently participated in chapter 10 of the Veteran-Centered Care in Education and Practice book that was just published in December of 2020. I'm also very involved in enrichment activities when it comes to students, and those are listed there. But my focus right now is working with Sigma Theta Tau, the International Nursing Society. And I currently serve as a mentor, as an advisor for one of their Nurse Academic Leadership Academy. So the objectives of today's presentation is that the participants will identify the value of transforming nursing practice through research, identify trends of research, and apply knowledge learned in our own practice to the use of some of the resources that I will present. Again, through research, we can make the world a better place. So the value of research in transforming nursing practice. As you all know, nursing is a scientific discipline and it's a caring profession. The purpose of nursing research is generating new knowledge. If there's anything else that I think we want to impart to any new researcher is that we want to generate new knowledge and also replicate those new knowledge that we learn. Obviously, we have to use rigorous scientific evaluation. So I've already answered the word or the question what in terms of research as generating new knowledge, and who. Really, it's everybody. Anybody that has a passion and interest to generate new knowledge can really do research. You don't have to be a doctorally prepared or a master's prepared nurse to actually do research. Especially these days when the curriculum is changing, that we really wanted our students, especially the undergraduate, to understand that research is really the cornerstone of their own practice or their future practice. Why we do research? For the reason that we want to share new information. Also for the reason that we want to be up to date with what's happening. And I still remember those days. I've been a nurse for 30-something years when we used to use mail locks and heat lamp to help our patients' wounds get debrided. Nowadays, that's not ever even thought of, but something to the effect of having wound bags and more sophisticated type of dressing changes. And when do we do research? Really, it's just when we're able to. It's really important to address that at any point in our career. And how we do research, because we understand the process, but also we understand that we can get help from other people. So research is one of the foundation of evidence-based practice. And, talking about evidence-based practice is probably a whole new webinar, and I only have 10 minutes to talk about research right now. But for research to be called evidence-based, it must be studied using appropriate scientific methodology, replicated with consistent results in more than one geographic or practice setting, recognized in scientific peer-reviewed journals by one or more published articles, and followed with implementation guidelines. Now, this information was taken directly from this article, Evidence-Based versus Best Practice, from Medline, from one of the nurse. Her name is Moore. Her last name is Moore. But the reason why I interjected this slide is for everybody to understand that research is great, but if we can't implement it in practice, right, then what's the purpose and what's the use of doing research? So I think that even at the undergraduate level, most curriculum, at least I can say in the United States, actually have their designated evidence-based practicum or evidence-based theory and practicum so that we can expose our nursing students before they hit running as a registered nurse. What are some of the current trends in research? Nowadays, we looked up to the government or the state to tell us what's available. Now, the National Institute of Nursing Research, which is actually under the umbrella of National Institute of Health, itemizes the following on their website: clinical research, eliminating health disparities, preventing chronic health condition, about staying healthy, which is very important these days, women's health issues, preparing next generation in terms of training and career preparation, and really having a lot of minority investigators so that the investigators can bring their passion that really affects, their community. And some of the recent highlights in nursing research talks about the end of life and palliative care, symptom science, data science, and again, women's health. I just want to share this with all of you that data science, which what everybody calls or refers to as big data, is more and more really important as we look to see what's happening in our communities and around us. And I also want to share with you that I have just been so inspired. So this semester, I decided to take a programming class, and hopefully in the very near future, I can get a certificate in data science from my school. In terms of the current trends in research, I also want to focus that because of the recent and the current pandemic, everybody seems to be doing a lot of research about COVID-19 and how it affects patients and how it affects nurses and our state of mental health, and so on and so forth. So even though it's not listed here, I know that there's a lot of research that is being aimed in understanding more and more about the current COVID-19 situation. So what are the application and tools and resources that is available for all of us? First, the need for a high quality research and timely dissemination is obviously very important. And some of the resources such as the government sites, and I mentioned the National Institute of Nursing Research, and in the Philippines, I'm sure there is a government site that oversees some of the research protocol for the country. Understanding the institution's institutional review board, that's very important because we want to protect, obviously, our study participants. Organization that support research through grants, like Sigma is a great example of that, or specialty organizations. So if your specialty, in my case, is psychiatric mental health nursing, then the Psychiatric American Nursing Association also provide grants, and also finding good resource such as an editor, especially if you feel like putting things together and you don't have a collaborative group of researchers, that also would be very helpful. I think of research as a collaboration. Find people to partner that has the same passion and work ethic. And I thought this picture is really a good example when we think about research. So when we think about collaboration, one of the things that I want to share this with you guys is a lot of my recent research is really attributed to working with teams, not just within my university or interdisciplinary, but also across different schools. And it's really nice also to see that hopefully there can be this international collaboration between nursing universities, or not even in nursing, but in other disciplines. So here are my references. And I just want to point out that there are other resources there, but those are the two that I actually want to share with you guys: the Sigma repository and the Nursing Research Journal. So I want to thank you all for listening to my very quick 10-minute webinar. Again, my point of contact is listed there: edna.magpantay-monroe at shamana.edu. Again, have a wonderful webinar, and mahalo for the invitation.
Thank you very much, Dr. Monroe. So may I acknowledge the presence of Dr. Edna Magpantay Monroe is with us in our panelist. Dr. Monroe, good morning.
Or good afternoon here, or good
Good
evening
afternoon.
from Hawaii. Aloha, everybody. I hope you enjoyed the webinar video presentation.
Thank you very much. So some of my key takeaways here is the importance of evidence-based practice, the translational research, that all of the results and
Aloha, everybody. It is my
conclusion
pleasure.
should be presented and be utilized. And last, let's continue to learn. So for our Certificate of Recognition, Beta Nu Delta Nursing Society, Journal of Caring and Health Sciences, College of Nursing, Visayas State University. Certificate of Recognition is given to Prof. Edna M. Monroe for serving as a keynote speaker in the third National Nursing Research Webinar held on 24th September 2021, signed by Prof. Rudolph Martinez, convener, and Professor Joel Ray Akop, convener. Let's give a virtual round of applause to Doc Edna Monroe. Thank you very much. So to continue our program, may I call on our oral presenters. To start, Dr. Bakason served as ex officio chairman and provides progressive leadership of Bachelor of Science in Nursing in Biliran Province State University. An effective and efficient all-around nurse, exposed and trained medical, surgical, OBGYN, pediatric, and communicable wards, delivery and emergency room. Acted as nurse ward manager and nurse educator, responsible for the full implementation of patient-centered nursing care plan. For his paper, The Essence of Nurses' Will to Stay and Work in the Philippines Towards the Development of Nurse Retention Program by Dr. Silimar Bakaso.
Good day, everyone. I am Silmar Bakason, and I'm going to present to you my dissertation study entitled The Essence of Nurses' Will to Stay and Work in the Philippines Towards the Development of Nurse Retention Program. These are my correspondence. Flow of the presentation, disclaimer, background of the study, research question, Ulrico's philosophies, methodology, main themes and categorization, conclusions and recommendations, statics, presentation, references. These are the disclaimer of my study. Background of the study. Retaining nurses in the Philippines is greatly influenced by the phenomenon of push and pull factors. The push factors refers to the internal pressures from the conditions of the nursing employment due to socio-political influence. These factors include heavy workloads, low salary and health benefits, and less career opportunities. On the other hand, the pull factors pertain to the external pressures stemming from the opportunities that awaits them in overseas employment. Factors belonging to this category encompasses higher salary, more health benefits and the chance of migration, and better opportunities or career opportunities. Another vital factor that explains why nurses prefer to work in abroad is the sense of familism of the Filipino culture. Family tends to be the huge motivator for nurses to decide on working abroad. However, amidst these pressing issues, there remain nurses who still choose to stay and decide to serve the country. It has been observed further that there are nurses who continue to work in the country despite the internal and the external pressures they are experiencing. Their decision to stay gives them the motivation to work and the meaning of their personal commitment, family obligations, and love for the country. The nurse's decision to stay and work in the Philippines still remains unexplored, thus this study was conducted to address the gap. Hence, the research question, what is the essence of nurses' will to stay and work in the Philippines? The will to stay is a decision of the nurses, may be influenced by several reasons such as personal commitment and the love for the job, family obligations, Filipino culture, and the love for the country. The concept of decision that is interchangeably used with the will in this study is a faculty of the mind that directs actions related to the activities of their work as a nurse. The decision gives nurses the motivation to work and eventually provides the meaning that either implies satisfaction or sacrificing. The philosophical underpinning of the study is are the following. The philosophies of Rico, the philosophy of Rico on the symbolisms of evil, the philosophy of Rico on the freedom and nature, and Rico's philosophy on the fallible man or philosophy of the will. Rico conforms to the philosophical enterprise of language in hermeneutic phenomenology. He stated that the language is a symbol in hermeneutic phenomenology where it provides a vowel meaning which gives expression to the human experience. Symbolic language for Rico gives rise to thinking through the articulation of thoughts in the realm of symbols that forms critical points of the whole human experience. But how can this symbolic language, become the initial point of thinking in a philosophical viewpoint? He points out the need to meaningfully describe, understand, and interpret the primordial constitutes of human experiences which becomes the person's autonomous thought. In the philosophy of Rico on freedom and nature, underscores the two dimensions of the human being, the voluntary and involuntary. These two opposing concepts provide the transcendental understanding of the perspectives of a human being. They denote a substantial difference regarding their descriptions and interpretations, but create a complementarity of meanings when unified in the realms of human beings, freedom, and nature. The former is the uncovering the intentional structures of the decisions of a human being, while the latter is the point of acting the human being's decision. In essence, freedom creates the nature meaningful, while nature makes the freedom actual. These two terms inseparably connected with each other. Hence, relating this to the phenomenon of the will to stay, the freedom gives the meaning of the willing act to stay, while the nature materializes the willing act to stay. In the book of Fallible Man of Rico, states that global disposition of explicating the man's nature is through understanding the finite and infinite perspectives of human being. The former is described by Rico as what is seen, displayed, and appeared, be it a thing, a living thing, or a person in the world. It is ascribed to a philosophical stance, to an abstract view of one's self to the world. The latter denotes to what is not seen. It is the expression of the views, point of views, and in-depth understanding of things in the absence of things. As cited by Rico, man is infinitude, while finitude is a sign which points out to the nature of man's infinitude. The phenomenon of nurses' will to stay and work in the Philippines underscores the essence of the willing act, which is rooted in the infinity of the nurses' existence as they lived in the world. The infinity, in this sense, is described to give nurses the original of formation which binds them on the willing act, as these nurses express their decisions to will grounded by motivations. They also give a voluntary consent to the will, and that marks the unity of the finite and infinite perspectives of nurses' being in the world. The decision to will manifests joy, happiness, and sense of fulfillment of their lives. In essence, understanding the nurses' will to stay and work in the Philippines is attributed to the infinity perspective which gives meaning and happiness to their willing act. Methodology. The study utilized Dirichlet's hermeneutic phenomenology. The setting of the study was conducted in Eastern and Central Visayas. The study participants include 13 nurses who has earned at least 5 successive years of hospital experience as a full-time nurse, whether in job order, temporary or permanent status, currently working or has retired, male or female, regardless of age, has no intention or plans of going abroad as a nurse, has never worked abroad as a nurse, willing to participate in the study, and is able to describe his or her experience in Filipino, Visayan, Waray-Waray languages. The study also utilized Lincoln-Rubas criteria on ensuring the rigor of the study. This includes credibility, transferability, dependability, and confirmability. Data collection method. The data collection method commenced after securing the human research ethics clearance from the College of Nursing, Silliman University. In the face-to-face interview method with audio recording was done, participants are encouraged to be open, interactive, reflexive, and engaged in the discussions. The use of the open-ended questions such as, can you please describe to me the meaning of your decision in choosing to stay and work as a nurse in the Philippines? Probing questions was also instituted to to was also instituted to get more stories from the participants. The data analysis procedure was anchored on Rico's existential theory of interpretation and methodological approach. This include the pre-analysis phase or reflexive phase, and which includes um, the two phases, which include the reflexive consciousness and investigating the phenomenon. Reflexive consciousness entails about being aware of the environment and being aware of the participant. So, and investigating the phenomenon entails about questioning the participant about the meaning of their decision to stay in the Philippines. After which, the transcripts were given with face meaning of the language of human experience. And then after which, naive understanding was also done. And this naive understanding includes the identification of the free nodes, subthemes, and main themes. And these main themes were further categorized into the 5 existential life worlds of Van Manen, which includes live self-other, live time, live body, live space, and live things. An in-depth understanding includes incorporating philosophical stance of Riku and other theoretical underpinnings that will suit the study and the results of the study. And articulating and creative interpretations of the human experience involve writing a creative interpretation of the findings of the study, such as in this study, I I was able to make a poem. Findings of the career. Kara, my parents got sick. My mother underwent dialysis for 7 years, so I stayed here because they need my care as a nurse more than others. That is why I stayed here and did not go abroad. This is coded under the free node of sacrificing to personally take care parents and under the subtheme of interconnecting filial affinity and interconnected affinity with others as main theme. Purina, when I was working in the hospital, they have been very supportive because as I said, they elected me as a president of the PNA, Leyte chapter in Region 8. And then I was also the PNA governor twice. This is under the free node receiving support from the hospital administration under the sub-theme of stability of support and under the main theme of connected meaningful encounter. Mark, I became a regular referring to the position employee. I was given an item. My salary has increased. Coded as having a security of work tenure, sub-theme intersecting contentment, main theme harmonizing pleasure. Julius, my referring to the purpose of working is to earn the experience. The salary that I will earn will not matter to me. Coded as valuing the worth of work experience than salary under the sub-theme of valuing the work experience and under the main theme of spontaneity of staying and working. And the last main theme, Lauren, maybe it is my way of paying gratitude for them, referring to the hospital that I will serve them for the rest of my life until my retirement. Coded as serving the hospital until retirement, under expressing passionate love for work, and under passionate innovative resiliency. Conclusion, the five main themes gave joy to nurses' will to stay and work in the Philippines. Hence, this confirmed to the philosophy of RICO of the will, of the philosophy of the will and the freedom and nature. Recommendation. The recommendations of the study are directed towards improving the nursing practice in the work environment to boost the nurse's decision to stay and work in the country continuously. So this is the poem that I wrote based on the findings of the study. My will to stay and work in the country is a way of devoting myself to them and him. They nourished my being as I flourished with meaning to selflessly serve them and him of which they deserve. Though I encountered unpleasant events that make sense, my will to stay has never done. For my love for them is stronger and longer. For them, I will forever stay and never run away. The days that I lived in remarkable ways blaze the rays of my will to stay. You provide me the Lord to continue my work, which laid the space in which I laid. Henceforth, forever, I will be thankful to them for the things I receive, which serve as a blessing to my living. They give me the comfort of and contentment as I continue to work. Above all, they give me the joy which gives meaning to my being. And these are some of the references I use in the study. Should there be any questions, please feel free to message me on this correspondence. Thank you.
Okay, thank you very much, Dr. Bakason. So one of my takeaway is that nursing is a science and an art. No, you've come up with your meaningful, wonderful poem or literary piece as your output. So for our second speaker, our presenter, a part-time faculty member of College of Allied Science in Cebu Doctors University, Mandawi City. Cebu with PhD in nursing science, major in gerontology, nursing. Author of the publication of International Journal of Nursing Science entitled Can Nurses Remain Relevant in a Technologically Advanced Future? To present his paper, The Quality of Life Among Older Adults in Geriatric Nursing Home in Region 7, a proposed quality of life improvement program. May I call on Dr. Joseph Andrew Pepito.
This is Joseph Andrew Pepito, and I am presenting the results of my dissertation entitled The Quality of Life Among Older Adults in Geriatric Nursing Homes in Region 7, a proposed quality of life improvement program. So here is the table of contents for this presentation. Disclaimer, I have no actual or potential conflict of interest in relation to this presentation. In Region 7, 8.36% of the population are those over 60 years old, which is equal to 680,964 based on the 2015 census. The number of older people who are incapable of looking after themselves in developing countries is expected to quadruple in 2050. Due to the increased life expectancy and longevity, the quality of life has been considered as an important issue in aging. Great challenges and changes in contemporary society and the increasing search for integration into the labor market for family members, that includes women, increases the number of older persons needing institutionalization because of the reduction of potential caregivers. As a result, the prospect of growing old in a family environment or expectations of the family to play the caregiver role of older persons are significantly reduced, even though the older person is an obligation of family, community, and society. Due to this, there's increasing likelihood of institutionalization as aging advances. Since the population of older adults in Region 7 is expected to increase in the coming years, the researcher seeks to determine the quality of life among older adults residing in geriatric nursing homes and implement interventions that aid in improving the quality of life of older adults. So here is the conceptual model that the study is based on. Expanded conceptual HRQOL model for older adults receiving long-term care services and supports, health-related quality of life. This model focuses on health and includes aspects of health that have any influence on the quality of life ratings of older adults receiving long-term services and supports. The model states that health-related quality of life is influenced by several life domains, namely the characteristics of the individual, the characteristics of the environment, emotional status, and social support. The purpose of the study is to determine the quality of life among older adults in geriatric nursing homes and to create a quality of life improvement program that can aid in improving the quality of life of older adults residing in geriatric nursing homes. So these are the demographic profiles of the 278 respondents. And this is the quality of life of the respondents according to the 5 domains. 4 had an interpretation of good, namely the overall quality of life, physical health, psychological, and environment. While 1 had an interpretation of fair, namely the social relationships domain. There was a significant difference in all 5 domains of the quality of life among older adults when grouped according to educational attainment, type of family, and whether they lived in a private or public geriatric nursing home. Based on the results of the analysis, it can be inferred that as the elderly's educational attainment increases, his or her quality of life also increases. An elderly's socioeconomic status is greatly influenced by his or her educational attainment due to life opportunities, such as availability and accessibility of resources. Education is also known to influence the ability of a person to make informed decisions, and this can affect the opportunities a person can take advantage of. That would influence his or her quality of life. There is also a significant difference in the quality of life when grouped according to the type of family. This may be due to the availability of social capital in old age, which has a profound influence in defining and determining the state of well-being and quality of life. The elderly that belong in nuclear families have significantly better quality of life compared to those who belong in other types of families. The elderly that reside in private geriatric nursing homes also had a significantly higher quality of life compared with those that reside in public geriatric nursing homes. Because geriatric nursing homes that are operated as a foundation is largely unregulated, those that reside in private geriatric nursing homes have a higher quality of life, maybe due to the availability of resources that meet the needs of the elderly, like financial resources, healthcare accessibility, a conducive environment for aging, etc. Now, based on the findings, the following conclusions were made. Overall, the quality of life among the 278 older adults who were residing in geriatric nursing homes was good. The demographic profiles that had a significant influence on the quality of life of an older adult who resides in geriatric nursing home were educational attainment, the type of family, and whether they reside in a public or private geriatric nursing home. So this is a proposed quality of life improvement program. Based on the results of the study, the domain which had the lowest score was the social relationships domain and was interpreted as fair, while the other 4 domains had scores that were interpreted as good. So here are recommendations that can result in the improvement of the social relationships domain score. First is educating the elderly on the use of technologies such as computers, tablets, or smartphones that can provide them with alternative methods of communicating with their loved ones. Next is expanding new social circle and strengthening existing social circle through effective use of public or social spaces like the canteen, corridors, and meeting areas, or the residence room in the geriatric nursing homes that provide the elderly with more opportunities for socialization. And last is provision of collective activities in the geriatric nursing homes, such as cooking, dancing, musical activities, guided imagery, excursions away from the nursing home, community involvement activities, clubs, art therapy, exercise classes, gardening, learning type programs, mental aerobics, and showing movies, etc. These activities may provide the elderly with more opportunities for socialization that can result in the expansion of their social circle. Recommendations to ensure that an elderly can have satisfactory scores in the 5 domains of the quality of life despite having limited financial resources. Often in nursing homes, the elderly are supplied with the necessities for survival, but are often deprived of the necessities of living. Long-term care facilities provide excellent quality of care, but frequently overlooks quality of life. These are trends in long-term care facilities that have focused attention on quality of life that have the best chances of yielding positive results. First is we have consumer-directed and consumer-centered care. It is a method of delivering services that enable the consumers to have a greater control over their lives by giving them the capability to make choices about the types of care and services they access and the method of delivery of those services, which includes who are tasked to give the services and when. Under this approach, consumers are encouraged to identify their goals, which will become the basis for the agreement and care plan. The consumer decides the level of involvement they wish to have in the management of their package. Providers need to institute ongoing monitoring procedures and formal reassessments to ensure that the care package continues to be appropriate for the consumer. Assistive living refers to the classification of care that combines housing and supportive services in an environment that is home-like and strives to maximize the functioning and autonomy of its residents. Unbundling pricing refers to the practice of separating a package offer into a base offer with options for add-ons. The concept of unbundling site pricing can be applied to assisted living to serve the dual purpose of opening new revenue streams for providers and reducing the price for consumers to address the increasing demand for senior housing. In the unbundling services scheme, residents will pay the same base rents and healthcare rents, but ancillary services such as meals, personal care, such as massages and spas, transportation, and housekeeping can be added by the residents as needed. Consumer-directed care and unbundling of housing and services are approaches that geriatric nursing homes can implement that can lead to a decrease in cost related to residing in geriatric nursing homes while providing the elderly with the necessary services that will lead to an improvement in their quality of life. The physical environment plays a significant role in the elderly in long-term care facilities. Traditionally, they're designed in such a way that follow a medical model and emphasize the provision of skilled nursing care for residents, with a priority on the efficiency of workplaces for staff rather than the residents' livability. Poorly designed physical environments can hinder functioning and social well-being. There is a need to make a shift in the architecture of long-term care facilities that exhibit an awareness of the importance of key design features, such as colors, lights, and their significance for the well-being and health of the elderly living in the facility. The care environment should be decorated with furniture, handicrafts, flowers, and art. Colors are bright and light is adapted to each space for the creation of home-like environment while minimizing the sense of being in an institution. There should also be an option for the elderly to decorate their personal rooms. Environments that provide multi-sensory stimulation also improves the happiness, calmness, and a reduction in fear and sadness. A garden is an essential part of the care setting and is capable of providing diverse sensory stimulation. Well-conceived external environments provide the elderly with spaces for activity, privacy, and stimulation. Improved lighting in certain areas of the facility can also result in an improvement of the quality of life of the residents because it can enhance the visual and emotional well-being of the residents. Long-term care facilities should also have areas which can allow the residents to have a sense of privacy. There really is a need for the residents to be involved in the design process. Overall, physical environments with regards to quality of life can be summed up as those factors which permit the residents to control and organize their lives. And culture change in long-term care facilities involve resident-directed activities and care. Home environment, a positive relationship with staff, family, residents, and community, empowerment of staff, decentralized and collaborative management, and measurement-based continuous quality improvement with person-centered care at its heart. So strategies for change include the development of infrastructure with attention to unit prices. This means that the residents should be included in the planning for the infrastructure of the facility. Give the residents more choices in their care. Residents should have the capability to manage their own lives by having more control over the care and support they receive. Transparency should be promoted to enable the residents to use their budgets to purchase services of their own choosing. Changing the decision-making from top-down approach to decisions primarily made by the frontline staff and the residents. The care environment also needs to be decorated with furniture, handicrafts, flowers, and art, colors, and bright lights adapted to each space with effective use of natural and artificial light. Give the residents a choice in decorating in their personal rooms, and there should also be gardens and well-conceived external environments. Developing sources of information for consumers is needed so that the consumers can understand the new forms and offerings of long-term care facilities. This is a sort of dictionary or index that contains all the services and offerings that a particular long-term facility has. In developing feedback mechanisms for providers, information about quality is needed for quality improvement. Providers need to have discussion with quality of life issues with their residents and use that information to improve services. Creating supporting environments involve a shift in the culture in geriatric nursing homes to person-centered care, where the person is put before the task. In person-centered care, residents direct activities and care in a home-like environment where they have a positive relationship with the staff, family, residents, and community. The staff are empowered and there is a decentralized and collaborative management. Residents regain the control to make decisions and the frontline staff are empowered to help the residents in making informed decisions. The resident schedule is designed by the resident along with the staff. Provision of a home-like environment is essential with spontaneous activities that are available all the time, and there is a sense of belongingness. And in this way, in creating supportive environments, there's also a need for the residents to be provided with privacy. So that was my dissertation. Thank you very much.
Thank you very much, Dr. Pipito. So my takeaway for Dr. Pipito's research is we have the needs and involvement of our geriatric patients, and we should uphold their rights and their dignity. So for us to the third speaker, a former clinician with 10 years hospital experience, recognized from staff nurse to head nurse to nurse supervisor and nurse training officer, currently a faculty under School of Nursing and Allied Medical Sciences at Holy Angel University. My call on for his paper, Development and Pilot Testing of a Training Program for Introductory Evidence-Based Practice in Nursing, Dr. Louis Roy Catu.
So, I am Louis Roy E. Catu, and I will be presenting my doctoral dissertation entitled Development and Pilot Testing of a Training Program for Introductory Evidence-Based Practice, EBP, in Nursing. So, let us start. Under the table of contents, we have the introduction. Included here are the following. First, we have the literature review, then the aim of the study. Under the methodology, we have the research design, sampling, setting, research instrument, ethical consideration, educational intervention, data collection, data analysis, and finally, we have the results and discussion. For the introduction, a brief background of the study. According to the literature, introducing an evidence-based practice provides nurses with a scientific research basis to make well-founded decisions, which benefit the overall health of clients. It enables nurses to evaluate research evidence on the latest medical protocol updates for patient care. EBP is a major paradigm shift in bridging the research to practice gap in healthcare education and practice. Integrating a research-based practice is potentially beneficial for practicing nurses, patient, and hospital institution. Therefore, the purpose of the study is aimed to develop a tailored fit EBP training program for nurses and assess its effectiveness. Hypothesize that the proposed EBP training program design will be able to increase EBP knowledge and improve EBP competency among nurses. For the method section, starting off, is the study's research design. This research study used a one-group pre-test post-test design. You would look in the figure provided. It shows the flow of procedure. From the screen subject, eligibility of participants were chosen using a convenient sampling method. Registered nurses, regardless of tenure, who were currently employed in an educational institution as a nurse educator or hospital as a nurse clinician, were eligible to participate. Screen participants then were asked to take the pre-test after which the training will commence. The entry-level EBP course was made available to willing nurses who participated in this pilot study. After the training, participants were again asked to take the post-test for the completion of the study. For the setting, the research was carried out at a tertiary educational institution in Angeles City, Pampanga, Philippines. The EBP training program was delivered in a computer laboratory environment. For the data collection, the instrument used is the Academic Center for Evidence-Based Practice Readiness Inventory, ACE-ERI, developed by Dr. Stevens. For ethical consideration, the study was granted approval from Holy Angel University, IR. For the educational intervention, an entry-level EBP training program was developed based on the findings of the previous studies in the literature, including Kura, Daus et al., Fay et al., and Saket et al.
As well as my pilot study conducted prior this protocol entitled Nurses Awareness, Perceived Knowledge, Attitude Towards and Barriers in Evidence-Based Practice. It identified the challenges of nurses related to their
Competence in terms of EBP implementation.
developed training module was designed to provide nurses with an interactive forum. For face-to-face EBP training, this is before the pandemic, the EBP training program included a module of 8 to 10 hours focusing on delivering each step of the
EBP process.
A university professor in nursing research with expertise in EBP, a master's degree holder with outstanding research and EBP background was invited to serve as the module trainer for this training. If you would look in the image provided, several teaching learning activities such as lectures, group discussions, brainstorming, mentoring were carried out. Following Saket et al. First steps, which was to introduce EBP, followed by clinical questions, evidence search, critical appraisal of evidence, implementation, and evaluation. From the clinical questions to clinical appraisal of evidence, the emphasis was on applying knowledge and skills to a clinical scenario. Whereas the implementation and evaluation of the EBP project corresponds to practice, application, and evaluation based on the participants' data. To assess the training effectiveness, a formative evaluation of the participants' understanding of the course content was performed after each section of the module.
Was completed.
Prior to moving on the module's subsequent sessions, as you can see on the image provided, a ladder-like image, the EBP expert who also served as the module trainer ensured that the participants understood the content and were able to perform the required activity before moving on. To give further details on the data collection, participants were asked to rate their knowledge of EBP and confidence in performing EBP competencies. Before and after the training module using the ACE-ERI questionnaire for data analysis, IBM SPSS software version 23 was used to analyze quantitative
data.
Descriptive statistics were used to describe the sample's characteristics in terms of demographic profile. EBP knowledge and
Competence were then described.
the Wilkinson Sign Rank Sum Test was used to compute the difference in knowledge and competence of the participants between pre and post-test
training.
Covariates such as gender, area of practice, years of clinical experience, and educational level and hospital affiliations were included in the study to better understand the fundamentals of the training
program.
Finally, Wade's non-parametric analysis of covariance was used to examine the effects
of covariates.
In this table, this is the demographic profile of the participants. Majority of them were 30 years old or younger and were generally fit. Clinicians or practitioners and assigned to special area units. More than 2 years of nursing experience. Almost all of them are currently enrolled in a graduate school and majority of them work in a private hospital and have reported receiving little or no training in evidence-based practice. Second table is the participants' reported knowledge of
EBP pre and post training It has been shown to have increased after the training, particularly on the following items.
Strongest basis for clinical decision making. E, how systemic reviews are made, indication of a stronger level of evidence, locating the most rigorous systemic reviews, personalized evidence-based intervention. EBP is the integration of best research evidence with clinical expertise and patient values. Order of the 5 stages of knowledge transformation based on the Steven Star model and on expectation on the introduction of clinical practice guidelines or CPG. On the other hand, it is worth noting that even after the training, only 3 nurses properly answered the question about the most useful knowledge in the clinician's practice setting. Unsatisfactorily, there also showed a decreased percentage of correctly identified answers on
Following items after the training.
the list: clinically useful resource of EBP on the internet, critical appraisal skills, barriers posted by large volume of research, locating CPGs on hand washing, translating this evidence to CPG, and evaluation impact of evidence-based quality.
Improvement.
Table 3 shows their level of trust or confidence.
In using EBP.
Although participants had the lowest confidence before training in the areas of identifying sample statistics commonly reported in evidence summaries and identifying major patches to be made explicitly in CPGs with assistance and existing criteria checklist with a mean score of 3 for each. It was discovered that scores increased after
Training.
from 3 it became 4.39 and 4.26. Disseminated scoring table shows that the participants' EBP knowledge improved from a pre-test mean score of 7.04 to a post-test mean score of 8.30. Their confidence in using EBP is reflected in pre-test mean score of 64.61 to post-test mean score of 88.40. The Wilcoxon signed rank test, the other table, revealed that after the training program, EBP knowledge and confidence in using EBP improved statistically significantly. It demonstrated that based on the analysis of covariates, the age, area of practice, years of practice, type of organization had no statistical
Significant effect on participants' acquisition of EBP knowledge. In the same
table. It was shown that the following had no statistically significant effect on the participants' confidence in employing
EBP
age, area of practice, years of practice, types of organization. Overall, the statistically significant difference in EBP knowledge and skills seen among nurses who participate in the training program showed that the program was effective. It was noteworthy that evidence-based practice is improved by teaching it through empirical validated in the training program. As a result, this study offers insight into the good outcome of this tailored fit training program as an evidence-based approach initiative aimed primarily at nurses who are still in the early stages of implementing PBP. So strangely enough, the logical step for knowledge development is practice sharing, which is given by a tailored fit educational training program. In general, these training programs' value and benefits are recognized by the participants. The main strength of this evidence-based project was providing nurses with EBP knowledge and competency. As an educational intervention, this EBP training program supported the need for nurses to be empowered to implement
EBP
redesigning the healthcare delivery, transforming to a more effective, safe, and efficient nursing practice. It enhanced the learnings from EBP process were consistently practiced. Utilization of evidence in practice will improve quality service, patient safety while decreasing costs, waste, and
inefficiencies.
care system. The project presented a unique opportunity to support EBP initiatives. Participation in EBP knowledge and competency training can lead to improved reasoning about practice changes in nurses. This encourages nurses to raise EBP awareness, recognize the nurse's critical role in the EBP process, and drive practice change based on research evidence. The program also offered a motivating opportunity to support EBP initiatives, which statistically improve participants' EBP knowledge and confidence in using EBP. The research has revealed some insight into a simplified and practical method of teaching knowledge. I think that would be all. Thank you.
Thank you very much, Dr. Kato, for your wonderful research paper. So one of my takeaway here is there's gaps in implementation of evidence-based practice in nursing, and your result could be a basis for policy development in terms of strengthening the EVP in nursing practice in the Philippines. So to that, let's give a virtual round of applause to our presenters for today. So to present their certificate of recognition, I read the citation: the Beta Nu Delta Nursing Society, Journal of Caring and Health Sciences, College of Nursing, Visayas State University. Certificate of recognition is given to, for presenting his research entitled The Essence of Nurses' Will to Stay and Work in the Philippines towards the Development of Nurse Retention Program in the third National Nursing Research Webinar held on 24 September 2021, signed Professor Rudolph Martinez, Professor Joel Ray. Let's give our virtual applause to Dr. Silmark Bakason. Same certificate is given to Dr. Joseph Andrew Pepito and Dr. Louis Roy Cato. Now, I invite the three speakers for our open forum. So in the interest of time, we will have only one question per presenter. So may I read one of the questions for Dr. Bakason? The bulk of reported workforce research focuses on nurses working acute hospital and frequently concludes that multiple additional factors influence nurses' intention to stay, reflecting both reality and complexity of the problem. Yet there's a limited understanding of how nurses try to stay in nursing throughout their career. And what are the factors that contribute to this? What are your thoughts on this observation? Dr. Bakason?
For a while, I'm reading the question. So, I think, hello, am I here?
Yes, Doc.
Okay. So I think based on my understanding of the question. So maybe there are still some of the factors aside from what has been revealed in my study that contributes to the nurse's decision to stay, whether the nurse is actually working in a primary, in a secondary or tertiary levels of care. So whatever the decisions of the nurse to stay in that levels in that hospital, maybe that gives him the motivation to continue to work, and maybe that decision or that factor is actually giving the nurses sense of joy and contentment. And it does not always underscore that the decisions of the nurse is actually governed by by uh, mm, by happy moments, but actually it also tries to underscore some of the events in which nurses tends to sacrifice in order to continue to work. And I think that gives her more value of her more value to the nursing profession amidst the reality during this pandemic.
Okay, thank you, Dr. Bakason. So for our Dr. Pepito is not available for today, but you can send your questions to us and we'll email the question to Dr. Pepito. Thank you. And for our question for Dr. Katu, over the past 2 decades, more than 300 articles have been published on teaching evidence-based medicine alone. In excess of 30 experiments have evaluated adoption of evidence-based recommendation for teaching EVP. However, point to poor uptake of existing resource available to guide EVP education. How will you reverse this poor uptake via your new EVP training resource in the Philippines? Dr. Katu?
Thank you very much for that question, sir. So for my EBP training research paper, the uniqueness of this study when I done this study, uh, primarily the bulk of this study came from the assessment of the institution. So on my idea on this, why there is a poor uptake of EBP implementation, probably might be due to poor assessment of per institution's needs. So before I was able to do this EBP training paper, I assess different institution before coming up on their specific needs. So to tailor fit their training in relation to EBP as initiatives or bearer of new insights in relation to EBP, it is best, so it is important that we assess the needs of the institutions or the nurses or educators' needs first before doing or implementing or experimenting EBP training programs. With this, there are different level of EBP needs that needs to be addressed, and there are different EBP training modules or seminars or research paper that are already done. But the key to mitigate this poor uptake is, I guess, to assess their needs first and then develop a tailored fit training program with their specific needs per institution. So that's my answer, sir.
Thank you very much, Dr. Katu. No, that's very feasible, and also we should increase the uptake of our EVP and training train our nurses not to utilize evidence-based practice. Thank you very much. And I recognize some of our attendees raising their hands. Dr. Gian Carlos Torres, can you unmute your mic? Thank you. Dr. Gian. Okay, so Dr. Gian. Okay. Um, Miss Lorelei. Miss Lorelei. Okay, so to that, so thank you very much, our panelists. Let's give them a virtual round of applause. Might I ask Doc Monroe for us to have also join us in the virtual stage for a picture taking of the panelists with our speakers.
So, okay, but I don't have my picture. I mean, I can't unopen because it says it's disabled by the host.
You can now open your camera, Doc.
No, it says you cannot start your video because the host has stopped it. So.
Okay. So again,